Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for extract 1.
How are you feeling today?
Not very well. I've been having back pain.
How long have you been feeling this way?
About a week.
What is your general health like normally?
Very good. I'm usually quite fit and well.
Do you feel ill?
Yes, the pain is quite severe.
Have you had any serious illnesses in the past?
No, none at all.
I see. Let me examine your back. It seems you might have a muscle strain. I recommend rest, applying ice, and taking pain relief. If it doesn't get better, we might need to consider physiotherapy.
Thank you, doctor. I'll follow your advice.
How are you feeling today?
Not very well. I feel sick this morning.
I'm sorry to hear that. How long have you been feeling unwell?
About a week. I felt nauseous and vomited a few times.
Have you had any other symptoms?
Yes, I've been feeling very tired and weak.
I see. Have you had any serious illnesses in the past?
No, none at all. I'm usually in good health.
It sounds like you might be experiencing some kind of infection. I'll need to take your vital signs and run some tests. Have you been eating and drinking normally?
No, I've lost my appetite, and I'm not eating much.
That can happen when you're not feeling well. We'll make sure you get the necessary fluids and nutrients. Let's start by checking your temperature and blood pressure.
Thank you. I hope it's nothing serious.
We'll do our best to find out what's causing your symptoms and help you recover quickly.
I appreciate it.
You're welcome. Now, let's get you comfortable and begin with the checkup.
Good morning. What brings you in today?
Good morning. I have been having severe pain in my jaw.
How long have you been experiencing this pain?
It's been about a week now.
Is the pain constant, or does it come and go?
It comes and goes, but it's getting worse.
Do you feel any pain in your neck or cheek as well?
Yes, sometimes the pain spreads to my neck and cheek.
I see. Do you have any swelling or sensitivity to hot or cold?
Yes, my jaw is swollen, and it hurts when I drink something cold.
Let me take a look. Open your mouth, please.
All right.
It looks like you might have an infected tooth. We'll need to do an X-ray to be sure.
Okay, what's the next step?
After the X-ray, we can determine the best treatment to relieve your pain.
Good afternoon. How can I help you today?
Good afternoon. I've been experiencing a lot of pain in my knee and back.
I see. Is the pain constant, or does it come and go?
It comes and goes, but it's been more frequent lately.
Can you describe the pain in your knee? Is it more around the kneecap or the back of the knee?
It's mostly around the kneecap, but sometimes it spreads down to my shin.
And how about your back? Is it the lower back or the upper back?
It's my lower back, near my hips.
Do you feel any pain in your thigh or groin area as well?
Yes, sometimes the pain moves from my back to my groin and down my thigh.
Have you noticed any swelling in your knee or any stiffness in your leg?
Yes, my knee often swells up and my leg feels stiff, especially in the morning.
Do you have any pain in your wrist or elbow?
No, it's mainly just my knee and back.
Okay, let's start with some gentle stretches to relieve the pain in your back and knee. Please lie down on your back and bend your knees.
All right.
Now, slowly bring your knees up to your chest. This will help stretch the lower back muscles.
I can feel the stretch in my back.
Great. Hold this position for 20 seconds. We'll do a few more exercises to help with your pain.
Good morning. How can I help you today?
Good morning, doctor. I've been having some trouble with my appetite and digestion.
I see. Can you tell me more about your symptoms?
When I eat solid food, I have to chew it for a long time before I can swallow it.
Do you have any pain when you pass stools?
No, I don't have any pain with that.
Have you noticed any changes in your taste or appetite?
Yes, I have no taste, and I've lost 5 kilos in the last few weeks.
I understand. When did you last have a period?
About a month ago.
Have you noticed any changes in your sense of smell?
Yes, my sense of smell has disappeared, and I can't enjoy the perfume.
All right. Please take a deep breath in, hold your breath, then breathe out completely.
Good afternoon. What brings you here today?
Good afternoon, doctor. I've been having some trouble when I urinate.
Can you describe your symptoms in more detail?
Yes, I feel a burning sensation and pain when I pass urine. My urine is also cloudy.
I see. How long have you been experiencing these symptoms?
It started a few days ago and has been getting worse.
Have you noticed any changes in your urinary frequency or urgency?
Yes, I feel the need to urinate more often, but only a small amount comes out each time.
Have you experienced any fever or back pain?
No fever, but I do feel some discomfort in my lower abdomen.
It sounds like you might have a urinary tract infection. I would like to do a urine test to confirm the diagnosis.
Okay, what does the test involve?
It's a simple test. You will need to provide a urine sample, which we will analyze for signs of infection, such as bacteria and white blood cells.
All right, I can do that.
Great. I'll have the nurse give you a container for the sample. Please follow the instructions carefully to ensure we get an accurate result.
Will I need to start any treatment immediately?
If the test confirms an infection, we will start you on antibiotics right away to clear the infection and relieve your symptoms.
Thank you, doctor. I hope we can resolve this soon.
You're welcome. Let's get the urine test done first, and then we'll discuss the next steps based on the results.
Hello, doctor. I have been feeling dizzy and nauseous all day. My heart is also beating very fast.
Hello. Can you describe your symptoms in more detail? When did they start?
The symptoms started this morning. I feel very tired and can't do anything. My heart is beating very fast and sometimes I feel like I might faint.
I see. Do you have any other medical conditions or are you taking any medications?
No, I don't have any other medical conditions and I'm not taking any medications.
All right. I will check some of your vital signs now.
The doctor checks the patient's blood pressure, heart rate, and temperature.
Your blood pressure is a bit low and your heart rate is fast. Your symptoms could be due to various reasons, possibly a cardiovascular issue or a nervous system disorder. I recommend that you see a specialist for a more thorough examination. I will write a referral for you to see a cardiologist.
Thank you very much, Doctor.
Hello, doctor. I have been experiencing a lot of pain in my legs, especially when standing or walking.
Hello. Can you describe your symptoms in more detail? When did they start?
These symptoms started a few months ago. The pain is most severe in my calves and ankles, and I notice my legs swell up by the end of the day.
Do you often stand or sit for long periods during the day?
Yes, my job requires me to stand a lot, but recently I feel pain even when I rest.
Have you ever felt numbness or weakness in your legs?
Yes, sometimes I feel my legs are numb and weak, especially in the evening.
Have you noticed any visible veins under the skin of your legs?
Yes, I see some veins that are bulging and blue, and they sometimes feel painful and sore.
I see. Based on your symptoms, you might be experiencing venous insufficiency. We will need to conduct some tests to accurately diagnose your condition.
What should I do to relieve the pain while waiting for the test results?
You should avoid standing for long periods and try to elevate your legs when resting. You can also use compression stockings to support blood circulation. Additionally, avoid wearing tight clothing and try to stay active with light exercises. If the pain is severe, you can take pain relief medication as directed by me.
Do I need to make any changes to my diet, doctor?
You should eat plenty of green vegetables, fruits, and drink enough water. Avoid consuming too much salt as it can increase swelling. If you smoke, I advise you to stop as smoking can worsen venous insufficiency.
Thank you, doctor. I will follow your instructions and schedule an appointment for the necessary tests.
AVN Pharma Education.